Hey, welcome to this video training. In this video, I would like to talk about jargon and how you're going to pass your clinical exams by avoiding jargon. Not only that, you're going to save so much time by avoiding jargon. So without wasting any time, let's check the slides. So when you use medical terms and plain language is a most important thing. There are 20 essential transitions which every student or doctor needs to know. Then you start with the decision tree. Whenever you're using some terminology, always think, who is the target audience? I'm going to explain it and how to switch fluently in the middle of the sentence and some real OSCE scripts and scenarios. So let's see why jargon is important. When you're using jargon, you're actually going to confuse your patients. For example, you say you have an acute MI with ST elevation requiring urgent PCI. The patient who is a lay person will have no idea what acute MI is, what ST elevation is, and what an urgent PCI is. What happens is the patient becomes anxious, he is confused, and he will not give you consent for anything you ask him. So usually you lose marks. Sometimes you might waste time and that might cause failure in the exam. So what you need to do is you need to first plan. When you are using medical terminology, you need to ask yourself, am I talking to a patient who is a layman or a medical professional or the examiner? In the exam, there is an examiner in some stations or most of the stations. So what we do is when you talk to the examiner, you can use jargon. There is no problem when you use jargon with the examiner, but with the patient, we can't use jargon. So the first and most important thing we need to know is who is the audience. You need to know, is it a patient or a family member? And we need to have clarity. When you talk to a patient or family member, it should be plain English. This is what my mentor used to tell me. Think like you're talking to a 7-year-old child. When I'm talking to a patient, I still use the words tummy pain, any issue with passing water, simple things. I will not use the words like dysuria, do you have abdominal pain? I don't use that. I think like I'm talking to a 7-year-old child or a 10-year-old child. And when you're talking to them, you don't use the word abdomen, you use tummy. You use, does it hurt when you pee? Use simple, plain language when you're talking to a patient or the family member. Then when you talk to a colleague, that's when you can use jargon. There is no problem in that. So that's the first and most important thing. If your grandmother wouldn't understand it, don't say it, okay? Or if a 7-year-old child or a 10-year-old child cannot understand it, don't say it. Okay, so let's look at some examples. Myocardial infarction. Doctors and medical students think that myocardial infarction is a common term. So plain English, it is heart attack. CVA or stroke, it's stroke. Hypertension. Although hypertension is a common word, patients don't know it. You should use high blood pressure. Hyperlipidemia, high cholesterol. Dyspnea, shortness of breath. Palpitations, heart racing or funny sensation in the heart. Syncope, fainting or blacking out. So I usually say, have you ever passed out or blacked out? Epistaxis, nosebleed. Hematuria, blood in urine. Hemoptysis, coughing up blood. Pyrexia, fever. Tachycardia, fast heart rate. Bradycardia, slow heart rate. Arrhythmia, irregular heartbeat. Edema, swelling. Anemia, low blood count. Malignancy, cancer. Benign, non-cancerous. People say, oh, it's a benign lump. What is benign? Not everyone knows benign. Prognosis or outlook. Contraindication, reason to avoid. So these are some of the things in history, investigations, and management. When you're explaining things, make sure you use simple language. Now, let's go to the examiner. What is your primary differential? I suspect acute coronary syndrome, likely ST elevation MI. My differentials are PE, dissection, pericarditis. Okay, so here the examiner hears correct terms like ST elevation, MI, acute coronary syndrome, clinical knowledge, you get a big tick for it. But when you talk to the patient, you don't use this. You use the same sentence when you talk to the patient. I was telling my colleague, you're having a heart attack. We need a heart tracing and blood test to confirm. So this is what you need to talk to, the language when you talk to a patient. So this demonstrate empathy. You're using simple terms, and the communication is the most important thing. Don't dumb it down, translate it up. So, consent for procedure. How to explain it without confusing the patient. So this is what you need to do. You need to structure your explanation like a sandwich. Term, plain, check. So this is how it is. I need to perform a lumbar puncture. Plain translation is I need to take fluid sample from around your spine. So this is what lumbar puncture doesn't mean anything to the patient. Then what you do is you explain the detail, like we use a thin needle in the lower back to test for infection. Does that make sense? You remember here, term, plain, English, and check. We'll do a lumbar puncture at L34 to obtain CSF for microscopy. The patient will cry. So you can even draw a diagram saying, this is your spine. I'm going to put a needle in and I'm going to collect a sample of spinal fluid. So this is how you need to explain things simply to the patient. Don't use jargon. If you say, I need to perform a lumbar puncture on you, the patient will be scared. Instead, you can still use the thing, I need to perform a lumbar puncture, which involves taking a fluid sample from around your spine. We use a thin needle in the lower back to test for infection. Does that make sense? Always ask the patient. Sometimes patients are under fear or pressure, or they are in pain, or they're not in a good state of mind. They say, okay, doctor, and they sign consent. And later, if you didn't clarify it with them, then you might get into medical legal issues. Then the last slide is, this is, you have to use, memorize this 20 translations. Make sure you use jargon, simple language and jargon. Practice with the imaginary patient, present to imaginary examiner where you can use jargon, and try to use mock OSCE interruption drills where you are doing role plays with a patient or with your friend and they say, what does that mean? So try to use jargon and try to practice where you explain it in simple terms, because in the exam that can happen. Oh, I'm going to send you for a myocardial infarction screening or a troponin to rule out myocardial infarction. Tell your friend to ask you, what does myocardial infarction means? So that way you practice things in the exam scenario at home. So in the real exam, it becomes easy. Then make sure you don't forget the grandmother test. So don't make your patient confused. If you like this, then you will surely like my clinical mastery system, where you will be moving from confusion to clinical mastery. So this is my flagship course where I teach doctors and medical students how to be successful clinicians in 4 phases. The first phase is when you're reading the scenario, there is you use the ABCDE approach, then you use the direction mnemonic, you use clinical visualization protocol, you use the cognitive rehearsal technique. So these are all the techniques I learned by reading ancient Greek books, memory books, time management books, and that helped me a lot with OSCE or exam preparation. I use the same techniques in real life as well. Then we move on to phase 2, where we collect all the information here and we use them here. I use again another visualization technique. It's an ancient memory palace method technique. Then I use something called 4-layer history protocol. Then I use the traffic light priority system, where the red light, orange light and green light has significance. when you use this 4-layer history taking, you will never miss anything. You will save so much time, and you will have a step-by-step approach where you don't have to think. You're going in an automatic or autopilot mode. Then we go to phase 3 and phase 4, where we do the ill or well snapshot. Then we use the ABCD protocol. Then we go to phase 4, where we are using the management protocol. We use the now, week, month technique. So all these are going to help you pass your clinical exam and be successful clinicians. So there are, this is the same method which I've developed for myself that was able to, help me pass all my 16 OSCE cases in my first attempt, and my students passed all their OSCE cases, and many students had successful, exam results purely because of the step-by-step approach, how they think in the real situation, in the exam as well. And that will save you time, give you lots of confidence. So if you like it, make sure you look for the link somewhere around this video, and make sure you download the worksheets as well. They will be very helpful to you. I wish you all the best, and I will see you in the clinical mastery system.